At Rouge Valley, we are committed to excellence in patient care. As part of this commitment, and to help keep our patients safe from infection, we practice the 4 moments of hand hygiene. What is a hand hygiene moment? Moment 1, before patient or patient environment contact. This nurse, Paula, is going to see her patient. She knows she needs to clean her hands first to kill the harmful germs on her hands. Using the alcohol-based hand rub for 15 seconds, those harmful germs are gone. Because she is in the patient's environment, she can rearrange his things and check his vitals without cleaning her hands again. Paula needs to take a sample from the patient's Foley. This brings us to moment 2, before aseptic procedure. Look at the germs Paula has picked up just from touching her patient and his environment. She cleans her hands for 15 seconds before putting on her gloves because gloves do not provide complete protection against hand contamination. The use of gloves does not replace the need for hand hygiene. Paula has clean hands and is gloved, so she can collect her specimen. Now she is at moment 3. Moment 3, after body fluid exposure risk. Paula knows she needs to clean her hands at this moment in case the gloves had micro tears. After taking off her gloves, Paula notices her hands are visibly soiled. Because of this, she will wash her hands with soap and water for 15 seconds. Moment 4, after patient or patient environment contact. Paula does not touch the patient again, but touches his watch and his overbed table. She knows she has to clean her hands for 15 seconds as she leaves this patient and before she attends to her next patient. Paula has shown us some clear examples, but sometimes it's hard to recognize a moment. Take this example. Here a doctor examines a patient. He receives a page during the examination. When he is done with the pager, he continues with his patient. What moments did the doctor miss? He missed moment 4 after leaving his patient. He touched his pager without cleaning his hands, contaminating it. He also missed moment 1 when he did not clean his hands before resuming his exam, bringing more germs to his patient. To keep his patient and himself safe, he should clean his hands at each of these moments. Here is another example. This nurse, Joan, is about to miss a moment. While caring for her patient, the patient in the other bed asks Joan to hand her her phone. When Joan is finished, she returns to her first patient. What moments did Joan miss? She missed moment 4 after leaving her first patient, and moment 1 before touching her second patient's environment. She missed moment 1 again when returning to her first patient. To keep her patient and herself safe, Joan should clean her hands for 15 seconds at each of these moments. And our final example. Here we are in a Tier 2 clean room with a patient with a C. diff infection. The nurse, Pam, is wearing gloves and a gown to protect against the spread of C. diff. As Pam leaves the room, she takes off her gloves and takes off her gown and cleans her hands. What moment did Pam miss? Although Pam cleaned her hands after moment 4, after patient or patient environment contact, she missed washing with soap and water for 15 seconds. Now, after washing, the C. diff are gone. Let's review the 4 moments. Moment 1, before initial patient or patient environment contact. Moment 2, before aseptic procedure. Moment 3, after body fluid exposure risk. Moment 4, after patient or patient environment contact. Let's continue our commitment to hand hygiene and recognize the 4 moments, wherever and however they present themselves. Hands up, Rouge Valley, because we know they're clean.